We kind of call it tick-tock, tick-tock. Like
Yeah.
every minute is important.
The race against time is real.
Alzheimer's became the scariest word in the English language, surpassing cancer many years ago.
But new research is showing promise.
Hope that the drugs will work. Hope that the drugs will help others like me, even if I'm gone.
Now we're able to say, is there a plaque or not on a living person, which will allow us to move forward with the correct path for that patient.
Advancements that could change lives forever.
To realize that there might be light at the end of the tunnel where it may not put you back where you were, but it'll stop the slope and keep you on an even keel. That's a miracle.
Welcome to the Wellness Files, a podcast where we explore practical tools, research, and real stories. I'm your host, Kari Beal, and today we're sitting down with neuroscientist Kirsten Porter Stransky to talk about new research on Alzheimer's disease. Kirsten Porter Stransky, thank you so much for joining the Wellness Files.
Thanks for having me.
So you're a neuroscientist here at the University of South Carolina School of Medicine, Greenville, and I saw that your research has been cited over 1,000 times, so I thought that was pretty impressive.
Thank you.
And being a neuroscientist, I know you understand the brain, and with Alzheimer's, everything goes on in the brain with this disease. The disease takes over your brain. So I thought you'd be a great person to talk to go over some of the new research that's happening that I think a lot of people are interested in. But first, before we get into all of this new research, I want to go over what Alzheimer's disease is, how it interacts in the brain, and help people understand it. So can you just explain in simple terms what Alzheimer's disease is and what it does in the brain?
Alzheimer's disease is a neurodegenerative disease that usually happens in older adults. However, it can happen in younger or middle-aged adults as well, especially if you have certain genetic mutations. And you develop this pathology in the brain that's called amyloid plaques, as well as neurofibrillary tangles. And so there's lots of things that happen in our brain normally to keep it healthy. And when we sleep at night, there's processes that help clean up the waste in our brain. Unfortunately, with age, sometimes things don't get cleaned up quite as well. And also proteins can misfold in the brain and start to aggregate and perpetuate these neurodegenerative disorders.
So the amyloid plaque, it kind of gathers in different parts of our brain. Sometimes you were saying it takes over the brain. And then what does this do? Why does it all of a sudden cause memory issues?
Yeah. So you have part of your brain in your temporal lobes here called your hippocampus, and that's very important for learning and memory. And a lot of the pathology can start near that hippocampus, which is why we see deficits in learning and memory in patients with Alzheimer's disease. But as the disease progresses, that can go to other areas of the brain as well. It causes the neurons to not function properly, and eventually those neurons die. So you start getting shrinkage of the brain. And as it spreads to other parts of the brain, you can have other symptoms as well in Alzheimer's disease. In addition to the memory deficits, there can be changes in mood, certain psychiatric symptoms, changes in activity levels, abnormalities in sleep.
So that's why we want to attack the amyloid plaque. Okay. So I want to go over some of the things we'll discuss today. We'll discuss vitamin that could help reduce Alzheimer's disease or maybe slow the progression. We'll discuss the immune system to fight Alzheimer's, current amyloid plaque treatments. We'll go over PET imaging so we can identify the amyloid plaque in our brain. Also weight loss drugs, so GLP-1 drugs and Alzheimer's disease, and then lifestyle factors. I think that was really interesting when we've had some studies about if you just change a few things in your lifestyle, that could decrease your chance of getting the disease or improve cognitive function. So I thought that was really interesting. So let's first start with this vitamin study. I thought this was really interesting. Our reporter in Atlanta, Abby Kousouris, she did a story on what's called the Benfotiamine clinical trial. So she spoke with neurologist James Law from Emory University's Brain Health Institute, and they're talking about benfotiamine. If That's how you say it. I've heard it pronounced a lot of different ways.
There's lots of different ways to say it. I often say benfotiamine, benfotiamine. There's lots of ways I
Okay,
say
I've heard it
or-
pronounced like 5 different ways. So however you want to say it is fine. But can you explain what that is?
Yes. Many of our listeners have probably heard of vitamin B1 or thiamine. We get that naturally in our diet. Benfotiamine is related to thiamine very closely. Your body converts it similarly to act as thiamine in the body. However, it's a fat-soluble version rather than regular B1, which is water-soluble. And what that means for our listeners is that it's more readily absorbed and retained in the body. So it can pack more of a punch than regular dietary B1.
Yeah. And it's an interesting study because, with a vitamin, I hope that it would be a cheaper treatment than some of these other treatments that are out there currently that are very expensive. And I know that can be detrimental for people if they're trying to afford it, get their insurance to cover it. Maybe their insurance covers part of it, but cost is a big factor in a lot of this. So my hope is that since something like that is basically already on the market, it's something that could be affordable. We don't know, but that's my hope for it. Now, our reporter, Abby Kosoris, she did a story on this, so I want to listen to her a little bit. She broke down some of the statistics, particularly on Alzheimer's in the South and Southeast.
Some of the highest rates of Alzheimer's disease are in the South and the Southeast. The Alzheimer's Association estimates there are more than 180,000 Georgians living with Alzheimer's and more than 340,000 caregivers. That number expected to double by 2050. Researchers are trying to come up with ways to treat or slow the progression of the disease.
So I think Abby really brought home how many people this impacts. Both of my grandmothers had Alzheimer's disease and unfortunately passed away. I think everybody at this point knows someone or has a loved one that has Alzheimer's disease. She said it's expected to double by 2050, which I think part of the reason for that is we're diagnosing it more, which is good. But we don't know if it's just diagnosing it more or if it's happening more. I think that's something we're still trying to figure out. So with the potential of the Benfotiamine clinical trial, what have we seen so far with that? I think a lot of people are reaching for that hope. They want to hold on to something that will give them a cure, an answer, treatment in some way.
Yes. One study that was published thus far on benfotiamine gave it to individuals twice a day for a year, and they found a significant reduction in cognitive decline just taking this vitamin twice a day. Just twice a day. They took 300 milligrams twice a day. The good news was side effects were very low, especially compared to other drugs on the market for Alzheimer's disease. So to be clear, this is not a FDA-approved medication.
You definitely need to talk to your doctor. Don't just go out and buy this vitamin. It's something you need to talk to your doctor because we don't know the side effects. That's the thing with anything like this. That's why you have it in a clinical trial so you can look at the side effects. But it's interesting.
Yeah. It is very interesting, and a lot of people are curious what the mechanism here is. We do know that regular B1 is very important in the brain. If you don't have enough B1, that can cause a variety of learning and memory issues even outside of Alzheimer's disease. So it's actually not that surprising that B1 might be a great therapy for learning and memory issues such as in Alzheimer's disease. There are some studies showing that individuals with Alzheimer's disease may have lower absorption of normal dietary B1, which is why this benfotiamine, which is more readily absorbed in the body, could be a great alternative to just regular dietary B1.
That was going to be one of my questions. Why are we having it in this form rather than vitamin B1?
Yes, regular vitamin B1 is water soluble, which is your body does take it in, but it doesn't retain it quite as long. Benfotiamine is very similar chemically. However, it is what's called fat soluble, and then your body can retain it a little bit better. We still think in these clinical trials, patients would have to take it daily, if not twice a day, to get the levels you want. But thus far, the data has been very promising that it's readily absorbed into the body, and you can see it on blood tests then when they measure it. So it is being absorbed, it's circulating, and we're seeing these reductions in cognitive decline. So it is very promising. We still need to finish some more clinical trials. And again, as you said, it could be a lot cheaper than other medications for Alzheimer's disease.
That's the hope. All right, I want to show people where this clinical trial is happening. So you can see in our area, it's over down here in Charleston and in Georgia, but it's also happening all across the country. You can see over here in California, Arizona. You have over here, I think that's either Washington or Oregon, and then obviously a lot in the Northeast and the Detroit area over there too. So yeah, if we're interested, we'll have a link to it in our show notes. We'll also have Abby's story in our show notes as well. So let's move on next to using the immune system to fight off Alzheimer's. I already talked with you previously on this story, and I found it so interesting because it's kind of like the idea of immunotherapy, where we're trying to get our own immune system to attack the amyloid plaques. So explain what we found with this research.
Yeah. There's a few lines of research trying to use the immune system to directly fight Alzheimer's disease. Some of this originally stemmed from cancer research, that there are certain medications now for cancer that get the immune system to better attack the cancer through TIM3 through TIM3 in the body. But what's interesting is this is also expressed in the brain. And you have immune cells in the brain that are called microglia. And those tend to be more active when you're young in development, and they're sometimes less active the more you age. And unfortunately, then they're not always effectively attacking the Alzheimer's pathology in the brain, those plaques that we talked about. And the idea is that either with an immunotherapy like this, or if we can find a way to directly activate those microglia in the brain, those brain immune cells, they might be able to better directly fight the Alzheimer's pathology.
All right. Well, let's hope it works, as we
Great.
continue to study that. I find it very interesting. I mean, anything where we can use our own immune system. I was talking to a coworker the other day about CAR T-cell therapy. If you're familiar with that, and using that in immunotherapy for brain cancer. So any way we can, teach our own body to fight off, I think is really cool. Let's next talk about the current treatments for Alzheimer's disease. We have donanemab and lecanemab, which is also known as Leqembi now. I previously did a story on this, so we'll hear from Dr. Apsher in just a little bit. But first, I want to talk to you about these treatments. So how do these work?
These treatments are antibodies that are meant to directly attack the pathology in Alzheimer's disease. So until these medications came out, most of the treatments were focused on managing symptoms. And those treatments still have a role in the therapy for Alzheimer's disease, but they weren't stopping the progression of the disease. The hope is that these antibody treatments might actually slow the progression or maybe even stop the progression of the disease.
Because it attacks the amyloid plaque and actually makes it shrink. Is this a cure?
I would not be comfortable calling it a cure yet. I hope that we are on our way to a cure. We are seeing some really promising results with these medications in slowing the progression of the disease. But it varies in how effective it is patient to patient. And also it's more effective when it started earlier in the disease.
Okay. And so I spoke with neurologist Dr. Robert Apsher about this treatment. He said it's not for everybody and there are some side effects. So we'll pull that up and listen.
These bleeding complications and swelling complications are really a concern for all prescribers. They do seem to be uncommon in the sense that I think it was 12% of the subjects in one study had the bleeding complications.
Dr. Apsher says this is why patients must have extensive testing beforehand to make sure they are not more susceptible to complications.
They would have to have an MRI scan completed within 1 year, and then they would go through the cognitive screening to sort of see what their baseline is.
All right. So he was talking about the brain swelling complications. Do we know why that happens when you take this drug in some cases?
It's complicated, but as you can imagine, in patients with Alzheimer's disease, there's a variety of different things going on in their brain. They may also have some other risk factors, whether it's vascular disease, high blood pressure, cholesterol. And there are some patients that are more susceptible to that as well. So these drugs, although they're very promising and exciting, there are some serious risk factors. So it's very important to have a full workup and make sure this is an appropriate medication for the individual.
Okay. Obviously, talk to your doctor, see if this is the best treatment option for you. But yeah, very interesting. And now this kind of leads into the next topic I want to discuss. It's called Vizamyl. So this is PET imaging that you can look at the amyloid plaque that's in your brain. So it's my understanding this has been out for a while. We just got it at Bon Secours in Greenville. So I got the chance to talk with a certified nuclear medicine technologist about this. And so she said basically how it works is an agent is put in through an IV, and that travels up to your brain and kind of latches on to the amyloid plaque that's in your brain. And what it does is it allows a PET scan to then see that amyloid plaque that's in your brain. I thought this was very interesting. I said, is this something that anyone should get? Like once you reach, I don't know, I have a family history of Alzheimer's. When I'm 60 years old, should I get this? She said, talk to your doctor about it. So that a question she could answer. But what do you think of this technology?
I think this technology is very exciting. I share the concerns about not everyone getting it right away because although it is very safe,
And I'll
um,
play a soundbite from her in a minute. But yeah.
yeah, although it is very safe, it's a tool in the diagnostic process. So there is not one test yet that confirms Alzheimer's disease. To do a proper workup, your doctor's going to do a variety of tests. They're going to do cognitive tests, a variety of cognitive tests. They're going to take a history of how you're doing. Also, probably talk to your family members about how you're doing. They're going to do some blood work to rule out some other diagnoses. And even if it's clear that you have some form of a neurocognitive disorder, there's a variety of different types of dementia. And it's very important to figure out the right type of dementia for that diagnosis. They're not all Alzheimer's disease. There's other types. And you want to figure out the right one to inform the proper treatment plan. For example, if you have vascular dementia instead of Alzheimer's disease, the treatment plan might be a little bit different. But brain imaging is definitely one component of this diagnostic process. So it's very exciting that technology is evolving, and especially that we now have it here in Greenville.
Yeah. And I know with the new drugs out there, you want to be able to measure, is the amyloid plaque shrinking? Or with a vitamin, you want to be able to measure, is the amyloid plaque shrinking? So for me, I thought this was a neat technology to help us measure the effectiveness of various drugs and treatments. So I thought it was very interesting. Now, I spoke with Jennifer Delasanti about the safety of this type of imaging, because I think anytime somebody hears, CAT scan, PET scan, X-ray, they might think, what does that do to my body? So I did ask her just about the safety side of this. And here's
It is very controlled. It's minimal. We monitor the patient when they come in and out to make sure that the lowest amount is achieved for exposure. So it is incredibly safe. It will also leave the body over time because it is not a contrast.
So according to her, yeah, very controlled, and that it is safe for patients. But I think it's still something that, it's only been around for a certain amount of time. And the more patients that use it, the more we'll understand, exactly how safe it is. But yeah, good that we have the imaging technology out there to see the amyloid plaque. So next, let's go over GLP-1 drugs and Alzheimer's disease. So another term for this is the weight loss drugs, Ozempic, Mounjaro, all of those. So a large meta-analysis of 26 preclinical studies found that these types of drugs actually improved learning and memory in Alzheimer's disease rodent models, which I think is important. It wasn't in humans.
Yes.
This is only in rodents, which is usually, the first they test it out in rodents and then it'd be in humans. But what did you think of that?
I think this is very exciting. These drugs are now being studied in so many different ways.
Yes.
They've been used for a long time for type 2 diabetes. Now people are using them for obesity, and we're seeing all sorts of effects in individuals using them that might be important for different psychiatric or neurodegenerative disorders. So I think it's great that we're studying this for different brain disorders such as Alzheimer's disease. I appreciate so much how you emphasize these are preclinical trials because unfortunately, there are many promising therapies that have emerged from rodent models of Alzheimer's, but then don't fully translate.
Yeah.
So
Don't take weight loss drugs for Alzheimer's.
I
wouldn't.
wouldn't.
That's about
I wouldn't.
it.
And there are some side effects. I did look into this, and there was a systematic review published last year looking at what do we know in people so far with these GLP-1 medications for Alzheimer's disease. And the good news is that they do seem to have some neuroprotective effects in keeping the neurons somewhat healthy, having healthy metabolism for your neurons in your brain. Unfortunately, we're not seeing yet as robust effects on cognition in the human trials as we are in the preclinical trials, but I wouldn't rule out the GLP-1 medications just yet. I think we need more studies, and even if it doesn't cure the disease, as you know, we have a variety of treatments that can be valuable in the treatment approach, and there's a possibility that this could be one of them down the line.
Do you think some of the benefits we've seen so far from these weight loss drugs, do you think that's just like a ripple effect of people getting healthier, or do you think that's actually the drug itself?
That's a great question, and I don't think we have enough data to know for sure yet. I think it could be both. We do know that if you are unhealthy, that is not good for your brain and your body. And so just getting healthier body weight, and then especially you do need to have good nutrition. You don't want to just not eat. You need to have good nutrition even on these medications. Being healthier can improve your brain. However, there are also receptors in your brain that medication can directly affect. You have lots of these receptors all throughout your body and your brain. And so this also could be acting directly in your brain to change some neuronal processes. So it's possible it's not just making you healthy. It's actually impacting activity in your brain.
All right. Well, next we'll move on to lifestyle factors and improving cognition. So this one was really interesting. I spoke with the Alzheimer's Association about it. There is an international conference that just happened not too long ago. And I want to play a little bit from Catherine Lambert. She is the regional vice president for the Alzheimer's Association. And I was talking to her about this conference, as well as talking to her about just what this recent study found on lifestyle factors.
The Alzheimer's Association International Research Conference brings together thousands of researchers from around the globe to talk about all aspects of how we all work together to ultimately end Alzheimer's and other dementias.
Now, Catherine Lambert is the regional vice president for the Alzheimer's Association in the Carolinas and Georgia. She says there is promising research on lifestyle changes and brain health. One study was conducted at Wake Forest School of Medicine in North Carolina. It was a 2-year clinical trial involving more than 2,000 older adults, the first of its kind. It found that increasing physical activity, nutrition, cognitive engagement, and health monitoring can reduce cognitive decline.
When you look at that cognitive function and that testing, they were testing roughly 1 to 2 years younger in cognitive function than their actual age.
So yeah, that was very interesting. She said people were testing roughly 1 to 2 years younger in cognitive function than their actual age. Just to explain it again, there's 2 groups. There's the structured lifestyle intervention group and then the self-guided lifestyle intervention group. So she was talking about the structured lifestyle intervention group, which I see it as like a prescription lifestyle type thing where basically the doctor was very involved in these peer meetings and telling them what to do with their lifestyle, how to work out, basically prescribing activity and designing a program. So there's a lot of involvement. I thought the other thing that's important to mention about this study is most of these people were already somewhat unhealthy. So they maybe were overweight or didn't exercise very often. So it wasn't your typical super healthy person. It was somebody who was already didn't have the best lifestyle, and they were just trying to help them improve it, and they saw great benefits from it. So I know you work in lifestyle medicine as well at the university. So what did you think of this one?
I think this is a very exciting area of research. And as you said, at the University of South Carolina School of Medicine, Greenville, we teach lifestyle medicine through all 4 years of medical training for these future physicians. So that way they can incorporate these evidence-based lifestyle modifications to help both prevention and treatment of disease. And as you noted in this study, they had both a structured intervention group as well as a control group, which was a self-guided lifestyle intervention. And for our viewers to know, it is somewhat intense to go through the more structured. You're exercising multiple times a week, aerobic exercise, some strength training, flexibility as well. They're on a specific diet, the MIND diet, which has been shown to be helpful in
What is the MIND diet?
yeah, the MIND, great question. The MIND diet is a low sodium version of the Mediterranean diet that emphasizes eating lots of leafy greens, whole foods, fruits and vegetables, especially fresh berries. And you want to reduce how much red meat you're eating, not have too much butter, those
I'll have
types
to find a link to that as well. So people want to learn more. That's super interesting.
And the other thing that I think is noteworthy here is their control group didn't get nothing. They got they were encouraged. They were given some educational materials that were publicly available, and they were encouraged to try to do something that might fit their lifestyle. And there were some improvements in that group. They weren't nearly as substantial as those in the structured lifestyle intervention, but that's encouraging that even small changes in your daily lifestyle can have meaningful impacts in protecting against cognitive decline as you age.
Super cool. So yeah, hopefully this is something they could start using, like doctors could actually start using this, right?
Absolutely. And I'd love to share with your listeners as well. There was another study done by Dr. Ornish that did intensive lifestyle change. So in the study we were just talking about, those were older adults that were at risk for Alzheimer's, but weren't diagnosed with Alzheimer's yet. Dr. Ornish did a study with actual Alzheimer's patients, trying to figure out if we can slow the progression or even reverse the disease. And they did similar structured interventions. They did a whole food, plant-based diet where the participants were provided all of their meals and lots of leafy greens, again, fruits and vegetables, lots of whole grains, no ultra-processed food, no meat, no refined oils. And so it's a little bit of a different diet, but still a very healthy plant-forward diet. They did very structured exercise. They also gave stress management, some vitamins, as well as some support for both the caretakers and the patients. And what was neat, they found, again, these are patients that had been diagnosed with Alzheimer's disease. They saw improvements on 3 different cognitive measures for doing this only for less than a year's time. And also they did a measure of a pathology you can do from a blood test. And they actually saw reductions in that pathology from the test. So these lifestyle interventions have cognitive improvements, and they also might even slow or start to reverse the course of the disease.
Very interesting. I'll have to have you send me that link as well. But you were saying this is plant-based. I think there's a big debate right now about meat. I still like to have my steak. I'm on the side of, I think we do need a lot of protein. But I see it as maybe some people could benefit. I don't know. Kind of where do you see that? Like from this study, people might say, oh, I need to cut out meat. Kind of what do you think?
Yeah. So the data are very strong that the more fruits and vegetables you eat and reducing processed foods is good for your brain and your body.
So fruits and vegetables first.
Absolutely.
Maybe just like do that as much as you can.
If you want the biggest bang for your buck, doing a completely whole food plant-based diet does seem to have very strong effects. Although there also are data showing that the Mediterranean diet, which includes fish as well as lean meat like chicken, is healthy. I'm not saying if you love steak, I'm not going to tell you can't ever have steak again. But any progress towards reducing red meat and especially processed meat like hot dogs, sausage are not good for the body.
No pepperoni.
It's really not good for you. Yeah. But, I don't want to scare listeners away because any step towards eating healthier can have significant effects on the body. So if you're not eating fruits and vegetables, that's a great place to start.
Or more of them.
Yeah, or
I think most people
more
get a little bit.
Yeah.
But just trying to get more of them into your diet.
And the same with the whole grains. If you eat a lot of refined carbs with your breads, pastas, if you can start to switch some of those out to whole grains, that fiber is very important. It's your GI system and your gut there. You have lots of bacteria that are good bacteria, but there's also bad bacteria in your gut. And that fiber is so important for the good bacteria to flourish, and that helps your body better absorb the nutrients that you need to be healthy.
All right. Well, you kind of got to my last question, which is what should people be doing right now? I think about this because, yeah, my grandmother has had Alzheimer's. I know I'm still young, but some people are getting it early on. Early onset Alzheimer's kind of freaks me out, you know? I forget one thing and I'm like, oh my gosh, what's going on? So we kind of talked about diet. Anything else, any other advice you'd have for people if they're just trying to take simple steps? Maybe they have a family history, or maybe they're just diagnosed with early onset Alzheimer's. Some things they can do that maybe could help.
Great question. I would say for everyone, these lifestyle modifications are so powerful. For a variety of disorders, both Alzheimer's, other neurodegenerative disorders, and also a lot of disorders that people have, chronic conditions like high blood pressure, high cholesterol, diabetes. These lifestyle factors can both slow and potentially even reverse those disorders. So start by, again, including more fruits and vegetables in your diet. Cut out some of those ultra processed foods, the cake, the Twinkies, the extra sugars. You know, don't eat so much processed meat. Try to have some healthier versions of that. Exercise is very big, physical activity. If you don't enjoy structured exercise, that's okay. I personally don't like running. If you put me on the track, that's not going to go well. But whether you're gardening, going for a walk or hike with your friends, take the dog out, things like that are all great. Stress management's very big. A lot of Americans are living with chronic stress, and that chronic stress can make your brain not work as well. And so if you want to protect against Alzheimer's, maybe do some mindfulness. Even starting with 5 minutes of a mindful meditation a day can be great. Maybe try a yoga class. And then I want to emphasize the importance of social connection. These days, so many of us, we're both connected and not at the same time. We're all on our phones or the internet and feel connected, but we rarely get to actually talk face to face with people. And there's more and more research coming out that social connection is very important for brain health and happiness long term as well.
I've definitely heard about that if you have a social group, that might determine how long you live just as much as your overall health. And that's very interesting.
There's even been some studies that are trying to image the pathology of Alzheimer's disease. And there's some individuals that they've seen the pathology through imaging, but they're not seeing the cognitive effects. And so that's an active area of research.
So you have Alzheimer's based on like the PET scan, but you're not showing signs of it?
Yes, and I
could have Alzheimer's right now,
well, it's not Alzheimer's if there's no significant impairment with your life.
Okay.
But you're starting to have those there are some people that are having those brain changes as they're older, but they're not showing the behavioral signs, the changes in learning and memory. And it's thought that this is especially seen in individuals that have higher levels of education and maintain activity throughout their life. So if you use your brain a lot, if you stay active, stay engaged socially, if you eat healthy, it's thought that can actually buffer against some of that pathology in Alzheimer's disease.
They call them the brain games, right? So having a social group, brain games, just trying to test your brain, just don't sit there and be a couch potato.
Find ways to engage.
Any way you can to engage. And then you talk about lifestyle, diet, exercise, all of that. So super interesting. Well, thank you so much for joining us today and being on the Wellness Files podcast. I really learned a lot today. I think this was very helpful for people out there who, might have family history. Maybe they're just curious. Who knows? So
Thank you so much for having me, Kari. It was an
All
honor.
right. And I also want to thank Abby Kosouris from Atlanta. She contributed to this podcast. And we will have a link to all of the things that we talked about, all of the studies. I'll have a link to the Benfo clinical trial and the map of where you can see where all those trials are happening. And then, yeah, if there's anything you ever want me to cover, just let me know. My name is Kari Beal, and you can send me an email, you can subscribe, you can comment. Any way you want to give your feedback, we welcome it. So thank you so much.
Thank you.